Hi, I'm Dr. Russell Greenfield, and I'm here to speak briefly with you about microbes and antibiotics. When you think about it, most of us feel we have an almost unbeatable mastery over infections that have troubled humanity since the beginning of time. In some ways, because of this, the focus in recent years has turned to the prevention and treatment of chronic illnesses, such as diabetes, autoimmune disorders, cancer, and cardiovascular disease, and rightly so. But as it turns out, antibiotics have their dark side too. You see, antibiotics have often been used more than needed. And although things are better in this regard than they have been, antibiotic resistance has become a major problem. So much so, in fact, that some experts caution without a drastic change in means of preventing and treating infections, we could be looking at a health circumstance not significantly different from the days before the advent of antibiotics. You may have heard about something called MRSA, which stands for Methicillin-resistant Staphylococcus aureus. So-called staph infections, primarily involving the skin, were usually run-of-the-mill until recently. While they might occur, they could be treated effectively with existing antibiotics. Back when I was in training in the mid-1980s, resistant staph, or MRSA, was considered a rare but significant problem that pretty much only occurred in the hospital. But circumstances have changed dramatically. In fact, when a person presents to their doctor with boils on the skin, whether large or small in size, the first thought should be MRSA. The good news is that these types of superficial infections are still readily treatable in most instances. But when the infection gets driven deep into tissues or spreads, it can be dangerous. MRSA has been in the news of late, mainly in the sports section, because some professional athletes have developed MRSA skin infections. Teams end up spending lots of money to sterilize facilities in an attempt to minimize spread of the infection, which typically occurs through skin contact with someone either carrying MRSA or frankly infected with it, or the touching of contaminated surfaces. Eradicating MRSA and other resistant organisms can be a big, expensive, and difficult job. Now, I know it sounds scary, but please don't be fearful. While there are reasons for concern, we are not yet at a point where most infections are resistant to treatment. The fact is, however, there is an urgent need for new ways to prevent and treat infectious diseases. Of course, prevention trumps treatment. Fortunately, creative and effective interventions are on the near horizon.